Good afternoon, Patriots. This is the American Vision, broadcast on the TLBTV network and brought to you by the Liberty Beacon Project. I'm your host, Bill Muckler, and I'm speaking to you from my, and broadcasting to you from my home studio in Cocoa, Florida, which is on America's beautiful Space Coast. And you can see by the shirt I have on today, I'm a retired senior, and today we're going to talk about Medicare. And we're, I'm sorry, I break myself up when I think about this, because I think about how could the political establishment have created this massive bureaucratic boondoggle to make us feel like we owe everything we have to the federal government. And so here I am, I'm a senior sitting here in Florida, and I've got Medicare. Guess what? I got Medicare and I'm on Social Security. So I can forewarn you about the evils and the problems with all this. I was looking for another word. I couldn't use that word anyway because they would cut me off the air. The FCC would probably be after me. Actually, the guys in the black SUVs are probably going to be rounding me up pretty soon after I do some of these shows, because this is really a sequel, if you will, or some kind of a follow-up on my earlier shows, which have all been leading up to this point in time, and we'll continue on because there's still more story to tell. There's a very important narrative for you all. Okay, so Medicare is part of Social Security, and I did 2 previous videos on the Social Security Administration, and I exposed and debunked what a horrible Ponzi scheme this is. So if you go back and look at my previous shows, you'll see that one of them is about the Great American Ponzi Scheme. I think on the title of it, it just says a Ponzi scheme, but it's actually the Great American Ponzi Scheme. How the federal establishment has stolen our money from us and misused our money. And then I wrote, so that was what they did to us. And then the next was It's Your Money. And what I wanted to do is tell you about your money and how the 2020 Vision for America protects your money and gives you your money back, because it's your money. I want to give it back to you. So anyway, let's talk about 2020, A Clear Vision for America. When I wrote 2020, A Clear Vision for America, I didn't write it for myself. I wrote it for you, and I wrote it because I wanted to give you the benefit of my experience and my exposure to all this stuff that's been going on in America today. And I'm not going to use fancy words, and I'm not going to use my fantastic vocabulary, because when I get on these shows, I don't read anything, but and that's not exactly true, because I do sometimes read a little passage from my book, and I'm going to read a little passage from my book today, but it's short. And the whole idea is I want you all to learn what's really happening to you, so you can learn how to protect yourselves and your kids and your grandkids. And what I really want you to do is I want you to wake up, and I want you to get other people that you know, your friends and your relatives, your family, your loved ones, your neighbors, your business associates, your acquaintances, anybody you know. I want you to wake them up to what the political establishment is doing to us. And I don't want to be too repetitive, but we not only need to wake up, but we need to be enlightened. And that's what I'm doing. I'm trying to wake you up, and many of you are awake to all this, but you're not enlightened. You don't understand all this. And some of you know some, and some of you know a lot, and some of you don't know much at all. So it's all varying degrees. And what I'm trying to do is bring this to you And then what I want you to do is I want you to share this with everybody you know. Share this video, share this article. All you have to do is just click on the link and share the article with everybody you know, and tell everybody you come in contact with. Hey, you ought to see this crazy guy Muckler. He's telling us all about how we're getting screwed. Oh, I can't say that word. How the political establishment is stealing our money away from us, our hard-earned tax dollars. So, I know I'm being repetitive. Pareto's law, mathematically true. 20% of the taxpayers in the United States of America pay 80% of the taxes, the tax dollars in America today. That's a mathematical formula. I mean, it's true. Don't listen to all these figures that everybody tells you, the pundits tell you, and then the politicians tell you, because they're all trying to blow smoke up your. I can't say that either. You know where the smoke is going, and they're using smoke and mirrors to do it with, by the way. So, 80% of the people pay 20% of the taxes. Okay, so what's happening is those 20% that pay 80% are taken advantage of and screwing the 80% who only pay 20% of the taxes. Now, I want you to try and figure that out. And if you can't figure it out, then you're well on your way to being awake and being enlightened. Because really, when it gets down to it, of those 80%, they're paying 20% of the taxes. Really, about half of them, well, not half of the 80%, be more than half of the 80%. 50% of the people in America aren't paying anything at all, and they're actually getting money. They're receiving largesse from the Treasury that the 20% who are paying the 80% of the taxes are paying in. And then there's guys like you and me who, we're the country, the politicians haven't attacked us yet because we're not considered the ultra rich 1% who are stealing this money from the poor and the government and taking money away from them, so they won't have any money, and using it to buy beautiful villas in the Alps. So that's where we are today, folks. Where we are today is the federal government has instituted a great Ponzi scheme, the Great American Ponzi Scheme, and that's the Social Security program. And part of that Social Security program is the Medicare program. But when they started with Social Security back in 1935, and I explained the history of all that in the Great American Ponzi Scheme, Medicare wasn't included in that. In fact, there was no such thing as Medicare. I don't even know if they had even thought of Medicare. I'm sure they had, because they were always thinking about how they can steal our money. So we started out with Social Security. And so we have the Social Security Administration levies a tax on everything we earn. And that's everything we earn up to a certain amount of money, and that right now that's capped out at somewhere around $118,000 a year. So if you're making more than $118,000 a year, you don't have to pay Social Security. And the Medicare part, I think, goes up to around $125,000. You can look all this up. It's not important if you want to challenge my numbers. But the idea of it is that you have to pay the Medicare part of it. So how do we do this? Well, or how does the government do this to us? What they do is in our payroll deductions, if you're an employee, you have FICA deducted. And when FICA is deducted, that's just one of those things that are deducted, and they say, well, that's not really anything. That's not your taxes, but really it is. It's a tax. It's definitely a tax, and it's FICA. So it started out at 2%, 1%, on your earnings. Now it's up to 15.3%. But you say, well, wait a minute, I only pay 7.65%. is taken from my paycheck. And of course, if you're an independent contractor or you're self-employed or you have your own company, you're paying 15.3%. And if you're only having 7.65% deducted, that other 7.65 that's matched by your employer is part of your total labor costs, which really should go to you, but it's taken from the employer to go into the total FICA package of 15.3%. So how can the politicians, how can the political establishment and the regressive pundits and the regressives all continually say that the rich aren't paying their fair share? The rich are paying, they're the employers. They're paying that 7.65% for you. They're paying that money for you, and it's your money, because they should be paying that to you in your wages. You should be getting a 15.3% increase in your total wage package. So what your take-home pay should have 15.3% more in it. So where's Medicare come in? And I guess we all kind of have some kind of an understanding of Medicare, or we have some kind of a misunderstanding and misconception of Medicare, is probably more like it. But Medicare is for people, when you go on Social Security, then you can also receive Medicare benefits. So when you become 65 years old, and I guess it's up to 66 now, you are now eligible for Social Security, and you get your Social Security benefits in the form of a check. Pardon me, folks. Folks, I had to stop for a short commercial break. I want to give you a commercial. And obviously, all of my commercials are about buying my book and reading my book. But anyway, this commercial is going to be the anti-nonsense football league commercial. I don't want you to watch any more football this year on National League football or nonsense league football games on Thursday nights, Sundays, Sunday nights, and Monday night. Just reject them totally. And this is coming from the master of rejection. Do not watch these games. And, their attendance is down, the viewership is down. We got to let them know that we're not buying into them disgracing the country over a lie. And I've talked about that so many times before. You're probably tired of hearing about it. But the whole thing is a lie. And it's a disgrace. And what they're doing is this is being trickled down to the college kids, the high school kids, and even the Pee-wee football kids are now taking a knee. They're taking a knee in soccer. They haven't done it in the NBA, and they probably won't do it in the NHL at all. And the Major League Baseball is not in season right now, but they're not buying into it. But this whole thing it's a national disgrace. It's built on a complete lie, and it's all fostered by a subversive group, Black Lives Matter, and a few of those other groups like that. They're subversive groups that really don't represent anybody but themselves. Okay, and the commercial, back to Medicare, because you want to learn about Medicare. Okay, of that 7.65% that is deducted from you, they when they first started doing it, they didn't break it out, but now they have to break it out. So that's 1.45% goes to your Medicare tax. See, who could dream this stuff up but politicians who apparently don't have anything better to do but come up with schemes on how to screw the American people. Oh, I shouldn't have said that, should I? They'll be after me in the black SUVs pretty soon. Or maybe they'll lose my Medicare account, and I won't be able, or my Social Security account, and they won't give me any more benefits, what little they do give me for all I put in. Okay, so if you take 1.45 and you multiply it by 2, and I'm going to do the math for you, that comes out to be 2.9. So that 15.3% of FICA, I know this is getting too technical for you guys, 2.9% of that is tax going to the government for Medicare. But it doesn't really go to Medicare. It doesn't go into your account. Al Gore lied to us about the lockbox. There's no lockbox. It just goes into account. There's no money goes into the account. It's the Ponzi scheme. It's written down. It's not written on paper anymore. It's computerized, so it goes in the computer. So, they could even lose it, I guess. Anyway, I told you that Social Security is scheduled to be completely bankrupt. It really already is bankrupt, but it's going to be out of business bankrupt in the year 2033. And I said, if it lasts till 2025 to 2030, it'll be a miracle, because we're spending so much more money in Social Security than we're bringing in. Well, the same holds true for Medicare. So I'm going to read you a passage from 2020, A Clear Vision for America. And gosh darn it, if you'd get this book and read this book, you'd be so well educated. There's people have told me that this is the main reference book they have on their library shelf. When they want to find something, they look it up, and it's got 20 issues, 20 chapters. It covers everything important that the federal government has imposed on us over the past 100 years or so. So anyway, I'm going to tell you about Medicare. And this is a quote from the book, and this is a quote from a PhD, Dr. Michael D. Tanner, who's a senior fellow of the Cato Institute. And this quote: when Medicare was instituted in 1965, it was estimated that the cost of Medicare Part A would be $9 billion by 1990. In actuality, it was 7 times higher, $67 billion in 1990. Similarly, in 1987, Medicaid, that's the state part of it, which we're all paying for too. The federal government pays that to the states, right? So it's all coming out of our pockets, the taxpayers. We, the people, are paying for that. Medicaid special hospital subsidy was projected to cost, get this, $100 million annually by 1992. $100 million, that's what they estimated. When I tell you they underestimate all this stuff, they lied to us, because these aren't real numbers. Who'd have ever said Medicaid for 50 states would be $100 million a year by the year 1992? Think about this, folks. Divide 50 into $100 million, and that's $2 million a year. Do you think states could operate Medicaid on $2 million a year? No, it's laughable to think that they come up with this stuff. So whenever you read these projections, they're false, they're fake, they're lying to us. Let me go on. And I've researched all this, and the reason I've got this quote in there is I felt it was probably the most accurate one. So just 5 years later, however, it actually cost $11 billion. So they estimated it to be $100 million, and then it came out $11 billion. And that's probably even low. It's probably underreported. So figure out how many more times is 11 billion than 100 million. What's that, like a million percent increase? Can you believe this? No. It says more than 100 times more. Well, that's 100 times more, but the percentage increase is probably a lot more than that. And same quote, 1988, when Medicare's home care benefit was established. This is something new. It took them until 1988 to do this, pull this one on, to shove this one up us. Remember, 1965 was when they started this whole boondoggle. That was under President Lyndon B. Johnson, who was the author of the Great American Poverty Scheme. When Medicare's home benefit was established, the projected cost for 1993 was $4 billion. Oh, $4 billion. But the actual cost was more than $10 billion. So you can see right now that this ain't working. It's not working at all. And we're paying for it, and we're just sheepishly, gladly paying in these 15.3% of our time, toil, and talent into this boondoggle that's going to go bankrupt. And where's the money going to be? The money's going to be in the more than $20 trillion of national debt that we have. Because you see, what's happening is there's not enough people putting money into the Great American Ponzi Scheme that are taking it out. If we had 1,000 people putting in to every one person taking out, the Ponzi scheme works. But if you get down to, say, 100 people putting in and to every person taken out, then you're starting to work it down more. It's getting a little iffy. So the Great American Ponzi Scheme isn't as profitable anymore. It isn't as successful anymore. It isn't working quite as well. But guess what? Now we're down to less than 3 putting in for everyone that's taking out. And as the baby boomers start taking their benefits out at 65 or 66, guess what's going to happen, folks? It's going to be like 2 people paying in for every one. That won't work. And it hasn't worked for many, many years. It hasn't worked because the Social Security Administration is paying out more than $100 billion a year than it takes in. Plus, it expends about $65, $66, $67 billion a year for its own administrative costs. So what's happening here is this is all going to fall apart. It's all going to go bankrupt. And I'm just telling you, I'm not even telling you what they do to the guys like me, the senior citizens who think, hey, I'm retired, I'm living in Margaritaville, or I'm on the beach in Florida, or I'm retired and I've got the world on a string, it's all going to come crashing down on us. And I'm like I said before, I'm just hoping that my time runs out before my money runs out, because I don't want to be living under the bridge wearing my Hawaiian shirt. Yeah, maybe I could I wonder if anybody could live under the Cocoa Beach Pier. That would be nice, at least get a suntan out of it. So anyway, let me read something else for you that I got here. And this is from Dr. J.D. Foster. He's a PhD and a senior fellow from the Heritage Institute. So, I'm not bringing this all in just from one person or another. The lovely Lainey is trying to get my attention and let me know that it's time for me to stop talking, because she says I talk too much. Okay, so here's the deal. Reforms are needed for many reasons. Let me see if I can get this so it doesn't look like I'm reading or sound like I'm reading. And here we go. Reforms are needed for many reasons, but the compelling fact is that Medicare is unaffordable in its current form. Already expensive for seniors and burdensome for taxpayers. Got that? Expensive for seniors and burdensome for taxpayers? Its cost will soon outstrip its own resources by a wide margin, putting enormous pressures on the federal budget and the economy. Left unchecked, Medicare's claim on national resources will rise from 2.7% of GDP in 2007 to 5.9% by 2030, and eventually to 15.6%. Well, Remember the statistics I gave you before about how they estimated, 100 million, and then 5 years later was 11 billion? Well, let me tell you, I've looked into this and I've figured it out, and I've got my calculations, and I'm pretty darn good at this because I did this all my life. It's not like the CBO where they estimate something and then it's all wrong and everybody says, well, that was years ago, not now. And they make excuses and they do everything they can do to convince us that they didn't really mean to make those errors, and they didn't really have all the information, and they didn't really, want to, tell us something that was not true. It just didn't work out that way because something happened, Trump did it. Maybe Bush did it, because that's all we've heard for the last 10 years was Bush did it. Now we're hearing Trump did it. So what's going to happen is the amount of Medicare, the cost of health for keeping seniors like myself healthy is going to be about 25 to 30% of GDP. And GDP right now is about $20 trillion. So what's 25% of $20 trillion? Well, think about it. That's about $5 trillion. And that's an awful lot of money. And you know what's going to happen then? That's going to bankrupt the country. Actually, the country probably is bankrupt right now. They're just not telling us that because they're afraid they'll all lose their jobs if they tell us we're bankrupt. But when the GDP is 20 trillion and the national debt is more than 20 trillion, that means that the percent of national debt to GDP is over 100%. And I've studied this, and a lot of economists have. And when it gets close to 90% to 100%, you're bankrupt. And so how do they go about this? They get the Fed to print more money out of thin air to keep us afloat. And that's kind of like if you got a credit card and you're at your credit limit and you say, well, please, Mr. Credit Card Company, raise my credit card limit, my spending limit, so I can borrow more money, so I can put off going bankrupt this year to next year. That's where we are today. So in 2007, Medicare tapped the general funds of the Treasury for $179 billion. Think about that. That was in 2007. And you know why I'm telling you 2007? Because their numbers are lagging so much. They're not up to date because they don't want us to know what the real true story is today. They don't want to tell us about 2016. But if you work for any companies, if they want to have a profit and loss statement or a monthly report or some financial report or something like that, they have that out, like the first, second, or third of the month, right? These guys can't get anything out in 3 to 5 years, 7 years, whatever. They just can't do it. So anyway, can you believe how much money they're going over? Now, on the spending side, this is pretty interesting. On the spending side, this is more than enough money to cover the total outlays, the total budget for the Departments of Homeland Security, Housing and Urban Development, Interior Department, Justice Department, and State Department. That's just what Medicare is costing us, more than all of those departments, and most of them are kind of useless or wasteful anyway, is costing us. So this whole thing it's a bureaucracy boondoggle. And whenever you have a huge bureaucracy like this, you have tons and tons of fraud, because there's no fraud if you don't have a large bureaucracy. If you don't have a bureaucracy, there's nothing to fraud, right? So the bigger this gets, the more the fraud is. So I hope you're starting to get the picture. Now, I'm going to tell you about my personal experience with Medicare. My late wife, Jane, passed away in September of 2009. In 2009, that was the month that she was eligible to get Social Security and Medicare. And I think I told you that I had to jump through hoops for about 3 months and make 3 trips to the office and numerous phone calls. I probably spent a month of that year on hold with the Social Security Administration. And what we ended up with is we got a letter. And in this letter, and I was so upset with the letter that I crumbled it up and I threw it away. And I regret that to this day, because if I'd have kept the letter, I could have included it in my book and I could sit here and I could read it to you, because you won't believe what was said in this letter. But going down this letter, 8.5 by 11 letter, down the second last paragraph read, in essence, a death panel of physicians and bureaucrats and administrators and all kinds of actuaries and different kinds of people have said that my late wife was not eligible for benefits. She was in the hospital. She passed away in the hospital. She had a stroke. They didn't cover that. They just arbitrarily made a decision. They didn't cover that. Now you're saying, well, that would never happen to me. Well, go on Facebook or social media or talk to your neighbors and have them tell you how Social Security has screwed them over. And read all these horror stories about how all this is happening. And you'll start to understand what I'm talking about. This is bizarre. This is horrendous. This is the most horrible thing that the politicians have ever done to us. And this was all in the name of being regressive. The progressive regressives have done this to us. So let me give you some experience, some of my own experiences. I did not sign up for Medicare Part B until my wife passed away, because she had this wonderful health insurance program with Public. She was working for them, and they had this great program with Blue Cross Blue Shield. And of course, I guess Publix paid some of the premium, and my wife Jane paid some of the premium. And it was really a good deal, and it covered me. And so so I thought, why should I be signed up for Medicare when I really don't need it? So I went from the time I was 65 in the year 2000 until September of 2009, 9 years, where I didn't pay in. So then I was told, when I was going through this whole debacle, when I finally got the $245 check, for the hundreds of, more than $100,000 that Jane put in, I got $245 back. And I signed up for this. They said, well, yeah, you can sign up, but here's, you're going to have to pay a penalty. And I said, pay a penalty? What do you mean by that? And they said, well, you will be penalized for every month that you were not enrolled in the program. So 9 years times 12, that was 108 months. I got penalized for 108 months. I didn't take a penny out. I didn't make any claims. I didn't get any benefits. So you'd think that I could just start out fresh at that time. No, they penalized me for, in other words, they wanted that money going back. They wanted that money going all the way back to 2000, the year 2000. And since they didn't get that money, they wanted to get that money back. They wanted that money because they didn't get it from me. And you say, well, what money is that? Well, here's what you don't understand. When you get your Social Security Administration benefit check every month, they deduct Medicare. And it used to be around $94 and it went up to around $100. Now it's more than $100 a month. So you not only paid in your 2.9% in FICA, that's why I wanted to explain that to you in FICA, you paid that in. Now you have to pay more in, and yet it's still costing $179 billion more than what they're bringing in, even though they're getting all this money from you. So you got to understand that they wanted their money back. They wanted. It It wasn't their money, it was my money, and it didn't cost them anything. So it was like adding a tax on. So every senior that gets Medicare, you have a deduction for Medicare that's around, it's 100 and some odd now, and I don't remember the exact amount, and it just changed, you know, and you can look it up. So they take out more than $250 a month from me because, and they're going to take that out for the rest of my life because I was a bad boy and I didn't sign up for Medicare Part A and B way back in the year 2000. So, okay, you know, you say, wait a minute, what is all this stuff? Well, Medicare Part A is hospitalization, and that's free. There's no deduction for that. That's all part of the FICA 2.9% that you only have deducted 1.45% if you're working for somebody. So they take out this money every month, and then, so if, say the average person gets $1,000 a month from Social Security, they deduct a little bit more than $100 out, so you get about $880 or something like that. Then they came up with this thing. This was a Bush deal, and I guess him and Ted Kennedy worked this out. Another way to screw us and to get Big Pharma some money. And if you love Big Pharma, I'm sorry, and you're just going to have to bear with me. But Big Pharma is really behind all this stuff. And here's what's happening. They came up with a deal called Part D, which was prescription medicine. So you could get your medications paid for by the federal government. So now the federal government increased their insurance company division called Medicare, and they came up with Part D. So in Part D, you have to have a supplement on that also. So that ends up, it would start out $45 a month. Now it's up over $50 a month. So that comes out of your benefit check too. So the average person is making, say, $1,000. I'm just saying $1,000. It's a round number. And if somebody's making $1,200, you can kind of, you know, percentage it out, ration it out, and figure it out. So here's the average person making about $1,000 a month is now down to about $800 a month, of which you have to pay taxes on again. And you pay taxes on your Social Security. And but you can elect. You want them to take it out and take the deductions out, or do you want to pay it, you know, yourself as like an independent contractor or self-employed business owner or something like that. And so they take your money away from you. The money that you earn, they take away from you. So, you know, you put in, say, 300,000 and you think you should get 300,000 back, but you're probably only going to get about 150,000 back. But if you invested, you'd have got 1.3 billion back. And that's why I say they took your money and I want to give you your money back because they screwed you out of $1 million in your lifetime in this Social Security thing. So now I'm on Medicare, right? And so you can say, hey, here's a guy that's researched it, I've studied it, I've read the reports, I've analyzed it, everything, and I'm living it. I'm living the Social Security Medicare/Medicare life. I have the actual experience. And so I go to see one of my doctors, and I have a scheduled visit, and I go in there, and they've already got this in the computer. If you're a new person, look out, because you're going to sign a stack of papers like that thick. And every year you go in, you have to redo and refill out this stack of papers that's this thick and sign your life away and say, hey, you know, I'm here, I'm on Medicare. Have mercy on me. Please have mercy on me because I'm on Medicare. And I'm scared to death that if I do something wrong, you guys are going to take it away from me and I won't have any medical care again, you know. So we're screwed. We're living in fear. And we have to do all this stuff because if we don't, they tell us, you know, if you don't do this, then you can just leave, you know, because the doctor will not see you. The doctors have no idea what's going on. I've researched this. I've talked to doctors. They don't know what their costs are. They don't know what the billing is. I go into a typical doctor's office that might have 2, 3, or 4 doctors in that group, and they have anywhere from 15 to 20 administrators working there. I'm not talking about nurses. They might have 1 nurse. And they've got all these people that are involved in administration, in billing and insurance work and everything. They're spending all this money. It costs these doctors, millions of dollars to run an office. And most of them are run by hospitals. They have their satellite clinics or whatever. So I go in, and the first thing they say is, your copay is $50. Now, different plans have different copays, and some of them don't have copays. And what it is Medicare, you think, well, Medicare covers it. No, what you have to do is then you have to buy supplemental insurance. So I am with Blue Cross Blue Shield. I could be with any of the others. I don't know which one's better, which one's not. I wouldn't do anything with ARP, even if it saved me money, because I don't like to be beholden to subversive socialist organizations. AARP is not for the seniors. They're out to screw the seniors. Let me tell you that. I can tell you that right now. I used to belong to AARP, and now I don't. So maybe that'll give you a clue, right? AMAC's a pretty nice organization. You could join that. So anyway, I have my supplemental insurance. And what happens is my supplemental insurance then is taken out from my benefit check. So now they take out, for me, after they take out the $250 a month penalty they're taking out, then I have to pay my supplemental insurance. And that comes out of there too. So all this is lowering my take-home pay. My Social Security Administration monthly benefit check, which is now my new take-home pay, it comes out of there. And then they take out another 50 some odd dollars for the Part D. And so it leaves most of us seniors practically nothing. So everybody's thinking, oh, when, I got a 401k, or I got an IRA, and I got my Social Security, so I'm okay. Well, wait a minute. Your Social Security is not okay right now, and it's going to be gone in another 8 to 10, 12 years, so there won't be any at all. So I want you to be prepared for this, folks. You got to save up, invest your money, and make sure you're prepared, because it ain't going to be there. So by the time they start taking all this stuff out of there, my Social Security check is hardly nothing. So now I'm in the office, and I have to pay my $50 copay, which, pardon me, I don't really pay anyway. I just give them a credit card, and the credit card company collects it from me at the end of the month. So anyway, $50 copay. So I go in and see the doctor, and I'm in there for about 5 or 10 minutes, and they have a nurse come in, or some kind of a assistant or something like that, and they take my blood pressure and my temperature, and they have me get on a scale, and all that takes a couple of minutes. And then I'm shown the door after I make my next appointment to come back so I can get screwed again by this whole process. So anyway, this is what you got to look forward to when you're a senior. So now what they do is they send out a statement every month from some bogus organization that's affiliated with the Social Security Administration, I guess, does their fulfillment or whatever the heck they want to call it. And I get statements from the doctor's office, and they'll say what my visit was. I want you to pay close attention to this, and I'm just going to give you some round numbers. It varies. But my visit is, for example, $900. I was in there for 10 minutes, $900. Then it shows that my supplemental insurance covered $300 of that. And I'm just, using some round numbers to make it sound easy, because it varies a little bit up and down, right? Then my Medicare covered about $300 of it. So now all the doctor's getting is $300. And then it's discounted about another $150. So really the doctor's only getting about $150 from from Medicare and supplemental insurance, and they're getting 50 from me. So it's a Ponzi scheme, and they create all these numbers. And why do they do it? Because if the doctor only, the visit is maybe costs $100, which is what they end up getting. If they just billed $100, then they would only end up getting about $20 clear once Social Security and Medicare discounted everything and took their money out and wouldn't give you their money and so forth. And then what they'd have to do is they'd have to charge me $80. And so my copay would go up, and then I'd say, I don't want to go back there anymore because I can't afford it. Just be spending all this money. So see, it's just fraught with fraud. It's just such a stupid system, and it could only have been designed by the political establishment, and the whole idea of it is to steal money from us. So that's what your Social Security is all about. And guess what? So far, you know what I haven't mentioned at all is healthcare. It's got nothing to do with healthcare. It's got everything to do with the federal government being involved in the insurance business. And being involved in the insurance business means they can steal money from us. They can take our money. And so when you're paying this FICA, it's almost like paying premiums that you're never going to get any benefit from. It's like if you had a life insurance policy and you died, somebody's going to get some benefit from it. Your wife or your kids or your heirs or, somebody, If you have automobile insurance and you have an accident, they're going to pay some of it. They're not going to pay all of it. They're going to pay some of it. And let me tell you something about the other part of this is, and this going back to this whole identity politics thing is, identity politics is we have to cover the people with pre-existing conditions. So now we're setting the people who don't have pre-existing conditions against the people who have pre-existing conditions. But I've got a car, and it's getting a little old, but it's in pristine shape, and there's not a scratch on it. But if I decide I don't want to have insurance anymore, well, they won't give me a license plate. But if I get my license plate and then I drop my insurance, I can go for until the year's up. If I don't have insurance and I wreck my car, then I'm in deep doo-doo. So what I do is then I go to the insurance company and I say, hey, I want automobile insurance. And they say, okay, what kind of car you got? And is it in good condition? And I say, no, I just had an accident. And when I say, you got a pre-existing condition, we're not going to give you insurance on a pre-existing condition. So wait a minute. The government says healthcare, you have to, if I got a pre-existing condition, you have to give me insurance, and you have to give it to me at a low rate. Have the rest of those guys who are safe drivers pay my insurance premium and give me my insurance. It doesn't work that way. Okay, how about I own a home and I decide I don't want to have homeowners insurance and my house burns down. Then I go and I say, hey, Mr. Insurance Company agent, I want insurance on my home. And they say, okay, we'll send out an appraiser to appraise it. And I say, well, you don't need to do that. It already burned down. They say, well, that's a pre-existing condition. You can't have insurance. But the federal government, the politicians, the political establishment, the identity politicians, the regressives, they want us to insure people who have pre-existing conditions and have the people who don't. And they say, well, it's the right thing to do. You're lucky you don't have that condition. Well, some people, it's genetic and it's sad and everything, and I feel bad for them, but why should I pay the premium for somebody who didn't take care of themselves or got themselves in a condition where medically, you know, they're in jeopardy. They're in bad shape. What I would rather do is I would rather donate money to a charity, a private institution, and that are set up for that. We've got all kinds of hospitals. Like there's hospitals for children that take care of children free that have, you know, are born with these conditions and so forth. Obviously, we want to take care of them. We're compassionate. I just don't want the government to steal my money from me and the guys that they're going to decide who they're going to give it to. That's not right. That's not in the Constitution. That's not being independent. You can't be free when the government is taking your money and deciding who they're going to give it to. Let us keep our money and let us decide who we want to give it to, because we're charitable. We're the most charitable nation in the world has ever known. We'll take care of this, but we'll do it ourselves without having an IRS hold a gun to our head and say, you have to give us this money so we can decide who we want to spread it out to. That's socialism. That's the whole thing. So anyway, I hope I got the point across to you that this whole thing is one big Ponzi scheme, this whole one big whole fraud. And if you're old enough that you're going to be getting into it in a few years, you need to know something about it. And it's almost impossible to learn about because it's so complicated, it's so complex, it's so difficult to read. It's written in language that nobody can understand. For example, like this Affordable Care Act that was like more than 2,000 pages long, 2,200 pages long. And that didn't even include all the pages that it referenced to. I tried reading some of it and I just got sick of it. I just didn't even want to do it. I didn't think it was worth it because hopefully it'll be gone soon. I don't know. It appears that the political establishment wants to keep it because they like being in the insurance business. I guess there's a whole lot more I could tell you, but I guess the best advice I can give you is learn about these things. Read my book so you can find out about them. Get my book. I really just want you to learn. And I'd like to sign my book. You know, I like to sign on there. So I'm doing all this for you. I'm doing this for everybody. If you remember what I told you, I wrote my book and I used the idea that the best form of government is a government that's small, limited, and close to home, meaning the government should be small, it should be limited in its powers, and it should be local because people inside the Beltway in Washington, D.C. have no interest in what's going on in my neighborhood or my little town in Cocoa Village or wherever in the heck you are. If you're in New Madrid, Missouri, I know about New Madrid. That's where the earthquake was. But when everybody sees it, they think it's Madrid. But they didn't know in Missouri. We don't know how to pronounce the English language. So anyway, that's just a side note. Remember what I told you? Don't watch any nonsense football league games. Don't let your TV set on so they can count you up in the ratings, because that's how they do it. They know what you're watching. They know exactly what you've got on every minute of the day, just like they know exactly how much money you got and how much money they're not going to give you in your Social Security. Okay. Where the people have no vision, the people perish. Where there is no vision, the people perish. Where Americans have no vision, the Americans will perish. So boys and girls, thanks for watching. Be sure and share this. Tell this to everybody. Hey, help me out. I need to spread the word. I can't do all this myself. I'm working day and night, 7 days a week, trying to, get all this out, TV show, newsletter, articles, do social media, try and build up my newsletter subscription and all, and subscribers and everything like that. So give me a hand. Tell everybody about this, and what have you got to lose? You know, I mean, you know, you already lost everything to the government. How about, you know, just spending a couple minutes and spreading this around and telling people about what I'm doing and how I'm trying to help you. So in the meantime, boys and girls, until the next time, and I think the next issue is I'm going to have a very important guest. In fact, that hopefully the way the schedules work out, I've already recorded the show with Dr. Andrew Holt. He's an associate professor of history at Florida State College in Jacksonville, lives in St. Augustine. I'm a good friend of his in-laws, good Christian people. And he wrote a book called, and I don't know what I did with that book. It's called The 7 Myths of the Crusades, and it tells you everything about how the Crusades happened, and debunks all of the myths that we were led to believe, that the Christians were horrible people who went to occupy the Muslims and kill the Muslims and everything like that. This is a fantastic book. So he's going to be on. You really need to see that show, because very intelligent guy who well-researched and just destroys all the myths that we knew about the Crusades. And I'm guilty. I didn't know a lot of this stuff myself. Some of it I was a little skeptical about. Now I know. Now I know the whole truth, because I not only bought his book and he signed it for me, but I also bought the Kindle version, because I'm going to use a little bit of that in my upcoming book, 2020, A Clear Vision for Our Future, where I talk about our culture and our Constitution and our country. And of course, in the culture part of it, I want I want to make sure that everybody understands what's happening to us and how our culture is being taken away from us. Boy, we got a lot of things going on in this country, and I've always been on the leading edge of them. And folks, keep sending me all the articles that you send me. I really appreciate them. And unfortunately, most of the time when you send me stuff, I've already written this stuff in greater depth than what you're sending me. And I did it 3 or 4 or 6 months earlier. I'm on top of this stuff. So anyway, boys and girls, God bless you all, and God save our America. Till next time, be good, be careful, and keep praying that we'll get our country back on track again.